Let's talk about Africa. Africa right now is experiencing a major surge in COVID cases. If you hadn't heard, you need to know because we are all in this together. COVID is a global disease. Now, one thing you should know, and probably the most important thing, is they are on their third wave, their third surge. And cases now in Africa are sort of approaching what they were in July 2020. That is a year ago. Guys, I have a lot of you who are following me from African countries. And the first thing I'm going to ask is I want you to write in the comments, let us know which country you live in, where you are from, and what's literally happening on the ground. Tell us what's going on. Tell us what you're experiencing, what it's like. We're seeing news reports that there are shortages of oxygen, shortages of medical supplies, hospital beds, medical supplies, and things of that nature. Kind of the things that we had been hearing with India. Let us know what you are experiencing. Now, there are a number of factors that the World Health Organization and other organizations are saying is playing a role into why the cases are surging. And by the way, I should say that in many countries in Africa, cases have increased 20%, sometimes up to 40% over cases in the past few weeks. So they are climbing right now. According to the World Health Organization and others, the Delta variant is very likely playing a role. We know that's playing a role in literally all of the world, the Delta variant being more transmissible, more highly transmissible. That means it can spread quicker, faster, more efficiently. But also this Delta variant might be more serious, might be more deadly, more dangerous as well. But not only that, we know that we still all throughout the world have to adhere to safety precautions, especially if we are not vaccinated. So that means in African countries and in other places, washing our hands, wearing masks, social distancing, and doing all of those things and adhering to local regulations. I'm reading reports that on the ground there are lockdowns in African countries that are being put in place. It is very important to adhere to those and other recommendations made by local governments and health departments. The other thing that's likely contributing to this third wave is the cooler weather that Africa is experiencing right now. But the fourth thing is one that we really cannot and should not ignore. That is the COVID vaccine situation. Globally, 2.5 billion COVID vaccine doses have been administered, but less than 1% have been administered in Africa. Are you kidding me? Did you hear that? Guys, this is a huge deal. And not only that, nearly 85% of all vaccine doses have been given in high and upper middle income countries. Africa has a population of 1.3 billion people. It literally is 18% of the world's population. And you mean to tell me that the African continent has only received less than 1% of sort of the world's COVID vaccines that have been given? Guys, this is a shame. This is a tragedy. This is wrong. Not only that, but there are some African countries that have not even begun their vaccine campaigns. Look, I have a few things to say about this, and let me say some good news in the sense that we know that many nations throughout the world are literally working to send COVID vaccines to other countries who are in need. We know that's happening. We know the U.S. is involved in that. That is excellent. That needs to happen more. That needs to happen quickly, like now. Okay, that's a good thing. But I also want to remind us that there are many countries, such as the continent of Africa, that have very few COVID vaccines compared to the population, that have given very few COVID vaccines, that there are people who want the COVID vaccine who cannot get the COVID vaccine. Guys, and let me just remind us, not only do we need to get COVID vaccines to these communities, but we need to remember that, especially in places like the U.S. and other countries that are higher and upper income countries, where we're literally passing up the vaccine. We are literally passing it up, many people in this country. Passing it over, saying, no, thank you, I'll just do without. When we have many countries throughout the world that have not even gotten one vaccine yet, have not even begun their vaccine campaign. Few things I have to say about this is, number one, if you've been able to get a vaccine, you need to be grateful. Number two, if you've been able to get a vaccine and you've chosen not to, you need to rethink that. Because there are plenty of countries throughout this world that would love to have your vaccine and don't have that opportunity to do so. And number three, we need to work harder to get vaccines to everyone in this entire world. Africa, hang in there. We are with you. We need to be helping much more, and I hope that will happen. Again, let us know in the comments what is happening on the ground, what your experience is like, what's going on. Guys, I'm Dr. Jen Caudle. Please share this video with others. If you have not subscribed to my channel, please do so. Click the little bell for updates. Guys, please write in the comments what your experiences are like. Those of you who are in Africa, tell us what's happening on the ground. Guys, I'm Dr. Jen. I'll be back soon.